And then we'll share a bit of our results, what we found. Um, we found some improvements in death trends, also some persistent challenges, and a couple of other interesting findings. And then we'll have hopefully some time for reflections. We would love to hear from all of you, your reflections or any questions that you have, and then share a little bit about what is next on the horizon for this body of work, mortality, life expectancy, analytical work. Next slide, please. Okay, awesome. Thank you. So why do we look at death data to begin with? Well, death is a barometer of what's happening with the health of the population of, a country, a region, and in our case, in King County. Not just of what the health of a population is, but we feel that it's also kind of a barometer on social conditions. But of course, it's only one metric. And in fact, it's kind of like the end metric, right? The ultimate metric. So by the time a person dies, I mean, there's not much that you could do at that point. Um, However, and we all know here that health is much more than a death rate, but it has utility because it serves as that warning signal for systemic problems, for upstream issues that might be happening as we dig into that data, the differences among populations, et cetera. So that's why we at King County look at death data. We've done it for several years now, and because it is that barometer, it could enlighten us about things like what are the changing burdens of chronic disease for certain things, such as you'll hear Danny talk about this, or and also see more details in our broader report that's linked. For certain issues or outcomes, it could also enlighten us about the uh, intervention impacts of certain interventions. So, for example, the opioid epidemic is one such thing where um, the intervention and the impact happen to be tightly linked. So there's applications like that, and it's so basically, just to summarize, it uses a summary of physical health, social conditions, and helps us understand the burden of disease in our population. So here in public health, we have, like I mentioned, looked at that data since COVID, and we have actually four reports that you can find on our website, and the links to that are, I think, at the on the last slide. And just to summarize, a few things that we found over the years is during the pandemic, or actually right after the pandemic, was the first decline in life expectancy that King County experienced in maybe a decade, almost a decade. And we weren't unique in that. Many states and places, cities across the nation experienced this. And then more recently, also similar to what's happening nationally, we are seeing life expectancy go back up, although slower than a decline, but still go back up. Death rates decline. And so, really notable findings. And we're just really excited to be here and talk a little bit more about what we're seeing in King County. So, with that, I will turn it over to my colleague, Danny, for the next slide. Oh, I'm sorry. The next slide's also me. So, really quickly, a little bit, just some basics about how death data are created. So, the foundation of our death analysis are death certificate files. So, in the United States, when a person dies, a death certificate is filled in that state usually. In Washington state, death certificates are created for everyone who dies in the state. And it has a plethora of information. There's huge amounts of information on the demographics, cause of death, circumstances, family information, address, etc. A death is certified, um, which includes the cause of death, and this is done by medical professionals. So this could be doctors, physicians or nurses, but also coroners, medical examiners. While demographic information is filled by someone like a funeral director sometimes. So it's often a combination of people that fill the information in there. The cause and manner of death that's documented on death certificates is coded to national and WHO standards using what we call the International Classification of Disease, or the ICD 10 classification system. And so this really is the foundation for how we classify the causes of death in our analytical files. Next slide, please. And finally, now I'll turn it over to Danny.
Great. Thank you, Ailey, for setting that up for us. So before I begin, we're going to dive into the data now, but I want to point out that you'll see these little dots all over. I might call out a specific number, like you see on the slide. This is 81.7 years of life expectancy in 2024 for the county. But all of these represent our best estimate, but all of these estimates are exactly that. They're an estimate. And so there's some uncertainty, some fuzziness around that number. So for example, the 81.7 years, the range where we're 95% confident that the true number is between 81.5 and 81.9. That's going to become really complicated if I always give you all of the framing of like could be in this range and it'll make the graphics really confusing. But just keep in mind that this is our best estimate. And I just wanted to frame that just for some transparency. All right, so here in this graphic, we have life expectancy. Life expectancy is the average age that a person born today could expect to live to if they faced the health conditions of everyone living today. I know it's a little bit complicated, but I'm going to ask you to try to let that percolate in the back of your mind. So if we have a group of kids who are born today, like day zero, how long on average will they live given the health conditions that we have today? And on this graphic, we have life expectancy. The higher, the better, because we want to live more years, right? So here the range is from 76 to 82. And as we go from left to right, we're going from earlier years and then going forward in time, ending at 2024, which is where the most recent data is. So basically, we have a decade of data. At first glance, you can see very quickly what Ailey had mentioned, that we have the decline in life expectancy with the bottoming out in 2000 here in King County in 2022. And the good news is there's a rapid improvement, a rapid incline post 2022. So in 2022, we went from having a life expectancy of 80.6 years. In 2024, we're now at 81.7 years. So that's more than 1 year of life expectancy gain in 2 years. That's a really big deal. These fluctuations are not very common to increase like at that rapid rate. So this is really showing, okay, we're on trajectory to heal from all of the traumas that we've had societally from COVID. And then another thing I want to point out quickly on this graph is that overall, whether during COVID, before COVID, after COVID, King County is exceptionally healthy compared to the rest of the United States, which again, I think is something that we can rejoice in, that we live in a community where overall, of course, there are some people being left behind, which we'll see, but overall, we live in a county of exceptional health. And this is something that's great to know or to take account of. Next slide, please. Here we have the opposite. So above, we were celebrating, the higher end of graph, meaning higher life expectancy. Here, the goal or the hope would be lower on the graph. And in this graph, what we have on the up and down the XY axis is the age-adjusted death rate. The reason that we look at death rates instead of counts typically is because, well, two basic reasons. One is that the population size changes over time. Our county has been growing very quickly over the last 10 years. So we want to have everything scaled to the size of the population, but also the composition of the population matters. You could imagine if you had a population of people 18 to 35 years old, there'll be very, very few deaths, thankfully, because that's like peak health in life. But if we have a population that leans heavily towards senior citizens, we would have more deaths. When we have this age-adjusted rate, it'll kind of smooth over that, and it'll give us the overall death rate for a population accounting for that over time. So basically, this again represents our best estimate of the death rates, meaning deaths per 100,000. You can see that we had that peak in 2022 and then a sharp drop down to 2024. That's an 8.6% death rate change or decrease, which is great. So again, we're on trajectory to heal from the traumas of COVID, which is fantastic. I just said we usually don't use numbers, but I know all of you are wondering about the numbers. So here they are. In 2022, we had 15,543 deaths. And then in the most recent data point, 2024, less than 15,000, we had 14,906. So we have a 600 death difference, meaning decline in over 600 deaths during the last 2 years. which is fantastic. Again, because population has been growing, so it's even more fantastic than what it sounds. So we're in the right direction. Next slide, please. Here we're looking at opioid overdose death rates. And again, the lower on the graph you are, the better. And we can see that there is a rapid increase, a terrible increase starting in 2016, peaking in 2023, and then a pretty sharp decrease of 18% from 2023 to 2024. This is great. This is really good news. And what we are wanting to point out again is the scale. It's hard for us to understand, well, what's the shift of 18% in the death rate? What does this mean in terms of number of people? Well, in this case, it means over 200 people didn't die. If we would have maintained the previous death rates, we would have had an additional 200 deaths in this population, which we did not have. So again, a great success. We've turned a corner. It looks like we're going the right direction. Thank you. Next slide. And here, the last thing I want to point out where there's been improvements is that later on, we're going to look at the leading causes of death overall, the top 10. But the top two consistently for many, many years have been cancer and heart disease. And there have been pretty steep declines in both of them over the course of the last decade. Cancer deaths decreased almost 16%. Heart disease deaths decreased roughly 8%. And this is a big deal because they're substantial contributors to all of the deaths in King County. Foreshadowing, which you're going to see later, between the two of them, 40% of all the deaths in the county are because of these two causes. So if we can move the needle even a little bit on these, if we can decrease these death rates, the number of people impacted is going to be very high. So this is a success. Next slide, please. So we've had a lot of successes, as you can see, which is great, things to celebrate, things that we can be excited about. But there are some places where there are challenges and some persistent struggles. So life expectancy is on the right trajectory, right? It's going up, but we're still not quite back at where we were prior to the pandemic of 2018, 2019. Same thing with the death rates. The death rates are coming down very quickly, which is great, but we're still not quite back to 2018, 2019, which is where we were before the pandemic. And the opioid epidemic, the opioid overdose death rates that we saw, we're still in crisis territory. Yes, we had the decline, which I think was 18%, but we're still 2.75 times higher, right? Like 300% higher roughly than we were in 2016. So going the right direction, but there is still work to be done with certainty. Next slide, please. We're going to step back and look at the data a little bit disaggregated now. Everything before this was at the county level. But when we start to disaggregate the data, we see that there are disparities that are large and persistent over time. When I say disparity, I mean the gap between the healthiest population and any other population. So in this instance, I chose sex with female and male because it's simplest, because it's only two groups. So it's easy to see females are healthier in this life expectancy graphic. Their average life expectancy is roughly 84 in King County. But for males, you can see it starts off at around 80 and it dips down over time. So in 2015, that gap or that disparity was 3.6 years. In 2024, it got wider. It was 4.7 years. So you can see this by eyeballing it, that they're kind of spreading apart over time. But I'm going to show you the same data, but represented in a different way that I think might make it more clear. Next slide, please. So as we just saw, females are the healthier group here. So we're going to use them as our reference. So we're putting them at 0. So females compared to the best case scenario, the difference in their life expectancy is 0 because they are the best case scenario. And then all the blue dots at the bottom show how much male life expectancy has fallen short. So these are the gaps or the disparities. Each one of those dots represents the gap for that year. And then that blue line shows you the direction of how the changes in the gap are growing or shrinking or staying the same. Here we can see that the gap is getting bigger as you go to the right. The gap between the blue line and the black line at the top is getting bigger and bigger and bigger. So even though life expectancy for males and females has turned a corner and has been going up, there's still a substantial gap. Next slide, please. Here, the graphic is conceptually the same. So we're looking by racial and ethnic groups. And in King County, the racial and ethnic group that has the highest life expectancy is the Asian American community. So we're going to use them as our referent. That's the dotted line at the very top. And all those little dots that are color coded to the name of the racial ethnic group, that represents the gap or the difference between Asian American population life expectancy and the life expectancy of the other groups. And the lines, I think, are going to be very helpful here to see the direction of what's happening with this gap over time. And we can see that for the Hispanic community, the Black community, Native Hawaiian Pacific Islander community, and American Indian American Indian Alaska Native community. In every case, the gap has been growing bigger, meaning that even though health metrics may be improving in these populations, either the Asian community is improving at a more rapid rate, or perhaps one has stagnated and only other groups are growing. So it's hard to see from this graphic like why these gaps are growing, but there are gaps across the board, except when comparing the white community with the Asian American community. And I also want to point out the scale here. The scale is substantial, that in some cases we're talking about more than 15 years of life expectancy difference. Whereas if you think back to the previous graphic with the looking at male and female, we're talking in the order of like 3 to 5 years of life expectancy difference. So the scale is very important, and the fact that it's growing should be concerning. Next slide, please. Here, again, the same conceptual graphic. So we have 4 regions in King County. The healthiest region when we measure by life expectancy is East King County. So we're going to set them as our reference at the top with 0. Each one of the dots is the gap or the difference in life expectancy compared to East King County. And you can see very quickly at the bottom that for South King County, the line is going down over time, which means that the gap is getting worse and worse and worse over time. And you can see for North King County, there's a weird pattern where it seems like it was roughly stable over time, but then there was a rapid improvement in just the last few years. So kind of a mixed story when we look at disparities by region. Definitely, in some cases, there is increasing disparities. And in North King County specifically, there's a decreasing disparity or a decreasing gap. So these are the challenges that we faced or that we are facing currently in our county. And now, next slide, please. This one is more neutral. It's not an improvement. It's not something that's a challenge. It's more just trying to understand, well, what do people die from? What are the leading causes of death in our county? So we pulled out the top 10 leading causes of death. And the first thing is that these leading causes of death cause the vast majority of deaths. 70% of all of the deaths are caused by the deaths or these categories that you have here on this slide. And as I told you before, that cancer and heart disease account for roughly 40% of all the deaths. You can see how huge they are. Cancer in the upper right, heart disease on the bottom, cancer in the upper left, heart disease on the bottom right. You can see that so much of this graphic is covered by just those 2 causes of death. And then after that, we'll find unintentional injury, which you can think of as car accidents, falls, things along those lines, then Alzheimer's disease and stroke. So those round out the top 5. But I know a lot of people are curious, what do people die from? This graphic answers that, and you'll have it for your reference later on. I think that is my last slide reviewing the graphics, so I'll pass it back to Mariko to lead us perhaps in some discussion.
Thank you so much, Danny and Ailey, for sharing a lot of that background and context, and then the local findings here from King County. I think that I think we sometimes don't always get an opportunity to look kind of closely at these numbers in our own community, and so this is a really great opportunity to have you both do all of this work to analyze these data and bring it here to this space, and then also provide that background on where the data come from and how we also use this in the county and what the data might be able to tell us about locally here, what's going on. I actually can't see the chat, but also if folks want to come off mute, ask your questions in the chat, or raise your hand. I'm going to ask Ailey to help me. Oh, yes, I can see over here on her screen. We're presenting in the same room, but I wanted to let folks kind of either ask questions or, reflect if does this data resonate with you in some way, or is there something that has surprised you in looking at these data?
And
Um,
there are a couple of questions in the chat. So I don't know, Danny, if you can take those two questions while folks continue to think about what sorts of questions or reactions does this bring up for you?
Yes, thank you. So there's a question from Brett asking, do death certificates in King County only have two options for sex? To the best of my knowledge, yes. Because and with a death certificate, we're talking about sex very often, most often biological sex as opposed to conception of gender. And there's really no way for people to express their own sense of identity, like in a death certificate, since they're not, completing it themselves. Interestingly, even though you didn't ask about this, I'm just going to throw this in there. This also applies for racial and ethnic identification, that individuals obviously cannot identify themselves. And so there are discrepancies. Like if you were to survey people, like a certain population, and find out the composition of racial ethnic groups within there, and then if they were all deceased and you looked at their death records, there would not be perfect alignment because a lot of it is reported by family members or is even sometimes by observation by the funeral director or the coroner, whoever it may be. So there are some limitations with the death certificates. Then there's a question from Tara. Can you say more about the other causes square in the last slide? Was that the largest percentage? Yes, the other causes is the largest, but it's a composition or it's a compilation literally of all the other causes. So you can think like chronic kidney disease would be in there, or homicides would be included in there, suicides would be included in there, um, influenza probably would be in there. I'm trying to look at the chart right now. So it would basically be a compilation of all of the others, but individually, all of them would be much smaller. Like none of them would contribute more than 2% overall. Question from Darlene. Can you speak more about how looking at death data tracks intervention impacts? Are you saying that over time, counts of deaths for a particular cause of death can be used to track intervention impacts or trends in life expectancy can be used? Yes, I mean, one specific example is that here in King County, or it might be specifically in Seattle, I'm actually not sure. We have this concept called Vision Zero, where we desire to have zero pedestrian deaths, zero traffic related pedestrian deaths in occurring, period. And the easiest way to check that is, are we seeing the data? So far, we are not seeing the data. There remain pedestrians who are killed by automobiles, buses, etc. every year. So we're failing at attaining Vision Zero. So that's one specific thing, that there's a plan that accounts for the design of city streets, trying to lower speeds, trying to educate people in terms of how to use crosswalks, et cetera, all these different things. But the interventions are not being successful in terms of the ultimate goal, which is to have zero deaths.
I just want to jump in really quick to add to that. One of the example of that is the efforts of our opioid response teams here at Public Health King County. There has been, I think, nationally a huge influx of funding um, in the during the Biden administration, at least in opioid prevention. And so we, like many jurisdictions, have used that for a ton of naloxone distribution, education, awareness, trainings. And the thinking is that a lot of that is responsible for that steep decline in opioid deaths, because it's not really a decline in opioid usage, it's a decline in deaths. So that's another example. But there's only specific interventions, to answer your question, where something kind of has to be tightly linked to the outcome of death.
Yeah, thank you for that clarification and for those two examples. That's really helpful, especially with like the opioid related deaths. So you're looking at like the number of deaths in both examples, not necessarily the count of deaths definitely like are factored into the life expectancy, right? But I guess for me, the bigger question is because here in Illinois, our most recent death data is 2024. So if we got a lot of the funding and implemented the interventions in 2024, but we saw life expectancy go up because of the number of opioid deaths went down, could we definitively say, it was because of the interventions? But maybe it's sounding like it's over a period of time with very like concerted efforts in a specific, like the pedestrian, like the very specific cause of death. But this was helpful. Thank you.
Yeah, and I think, Danny, correct me if I'm wrong, but I don't think life expectancy might be the best measure of that. I think you just kind of want to see the death rate, which is the
Yeah.
converse of like, and that you can separate, like as Danny
Hmm.
showed, by causes, and you could look at opioid.
Yeah, totally. Thank you so much.
Let's see. I'm seeing a clarifying question come in through the chat. And Dan or Ailey, would you be able to speak to the ability to measure death rates for people who are intersex? Um, and also about if the sex information comes from birth certificate or based off of something else.
Um, I can field that question. So, from memory, it's entirely possible that I'm wrong, but I don't think that there's any way that there is a, I don't think there's any kind of tick box like on the death certificate, or at least in the data that we receive in the end for intersex. So, I really think it is binary, like female or male. And the sex information does not come from the birth certificate data. Sometimes on the back end, we might eventually do like a linkage between birth and death data, but that's not done upfront in the preparation of the death data. I think it's done based on anatomy, or perhaps maybe in a true like intersex situation, it might be maybe from uh, getting information from family members in the same way that other demographic information is received from family members. But I would imagine the vast majority of cases, it's from observation of anatomy.
Yeah, thanks for clarifying that, Danny. And to Sui, I see your comment in the chat as well. And I think, yes, that it is a administrative data, like death data is very limited in providing, I guess there's a lack of disaggregation that's available. It's determined how that information is collected. So, like you make a good point about Asian category, especially when we look at disparities. And although in King County, the Asian aggregate category, and when we look at that, may have some of the longest life expectancy. We know that within different Asian ethnic groups, there's a wide variety of different histories, access to resources, and kind of a culmination of things that make for good health or long life, and that yeah, it's not homogenous by any means, and so that is a really large limitation of the data that we have and how it's categorized, how it's collected. But yeah, acknowledging that we know that locally here in King County too, that there are large health disparities among Asian American and our neighbors too. So thank you for bringing that up. Oh yes, and Danny and Ailey did a wonderful job with the visualizations. I've really appreciated getting to work with you both on doing this and learning about how different ways that we can simplify some of our data. If you all would like the deep dive, we are going to share the links out for the report in these slides, or you can go to the King County website and search for our mortality report. And there's also a technical appendix in there if you are looking for more data, more information, and more methods. It is there, but I really appreciate Danny and Ailey and the effort and really care in presenting this information in a simplified way that's a bit more accessible than some of the other ways that we present data here at the Public Health Department. So a really large appreciation for you both. I am not seeing any more hands, but I know, Ailey, that there were a couple other things that you want to talk about. some next steps. Oh, sorry. Go ahead and I have limited view.
Yes.
Okay.
Um,
Yeah, I see Paul
um,
and
Tita?
sorry. Tita, yes, both of you have your hands up. And I think Paul, your hand was up first. If you want to just
Yeah, it's so fascinating and beautiful to see the data. My brain is curious. I mean, having been here for 36 years and seeing a huge increase in density and the number of people that have arrived in King County, I don't know if you mentioned the number, but it's enormous increase in population. So I just wanted to ask, if you look, say, over 35 years or 40 years, is it the case in public health that a lot of times if you have a huge influx and you have some idea of where people are coming from, the Midwest, East Coast, South, internationally, that you might see a dramatic shift in what the major causes of death or opioid overdoses based upon understanding the demographics of where this huge influx of people from all over the country or internationally are coming from. Does anyone do that work? And I just am imagining that would have a big effect on the birth rate, death rate, but also they're bringing in from whatever region they're coming from their own, potentially, genetic background, environmental background, etc. Right? So if someone came from an area that is, in general, a lot less healthy, or that is, a place that's very, very healthy from a public health perspective, would you see that in the life expectancy and in the causes of death data?
that I'm going to take a stab, and Danny, welcome you to join in. That is a fascinating question. All of that is possible. We typically haven't looked at our death data that many decades behind, like that trend. A couple of things that I have, I'm going to talk on the next slide about the city's lead project that we are going to be participating in soon. And some of these questions are really great ones for that collaborative. But a couple of things that I've heard folks talk about, colleagues, is this idea. I mean, the theory of like rapid population change and what assets or deficits is this rapid population influx bringing in is a really good one, but it can flow in multiple directions. One of the things that I've heard is the idea of new immigrants bringing in actually health assets, and then as generations pass by, the impacts of the health care system and inequities in this country actually decrease that life. So we see some of that in academic literature. The other thing I wanted to, oh my gosh, did the thought escape me, is that, yes, that across that time frame, which is like 30 years, 35 years, there are so many significant policy changes that have also happened that no doubt also contribute to that story over time. Like healthcare reform was a huge one. Seatbelts coming into place really decrease the traffic mortality, right? Motor vehicle accidents. So there's things like that, but it really is a very interesting question that I don't have a straightforward answer to. But
Yeah,
Danny, please go ahead. Oh.
I guess I was just going to say that, like, I remember in grad school at UW Medicine, like when we were studying, for example, when people would come from, for example, from South Korea and then come to like college, for example, in Seattle or King County, and then there like was an issue for them of acculturation, and then the college environment of lots of drinking and partying and stuff like that, and then sort of the acculturation impacts on their health. So I guess what I'm thinking of is if you take a population, move them to a very unhealthy area or geographical region, they're going to reflect that at some level, right? If you move someone who's in a healthy geographic area to a very unhealthy area, you're going to see the results of that movement. And similarly, if you take people that are existing in a very unhealthy environment and then move them to a very healthy geographic environment, you'll also tend to see changes in health in that sense also. So I was also just sort of knowing there's been a huge population explosion in King County that would be interesting to know to try to tease out some of those details.
like a 2-second comment on Paul. I just think like your question or your framing of this is, I mean, you're spot on, but I think to disentangle all the things that have happened and all the different populations that have moved in and trying to understand how long it takes for the environment to start to impact people's health one way or another. Like as you were saying, if someone's coming from a kind of low health context into King County, these are really deep, complicated questions. Maybe for a graduate student who has a couple of years to devote to it. But thank you for spurring these thoughts, and yeah, it's just fantastic to think about.
Ida, did you have a quick question? I know your hand is
Yeah,
up.
yes. Because I know in our community there's so many deaths during COVID, during the pandemic, and I was trying to get King County Examiner's Office to get some disaggregated data information because, among the Southeast Asian community, right, we're really small, and so you don't really see that. But that work because we're direct service. I'm with the my community of Seattle, King County, and so we're direct service, and so we see a lot of death in our community, and we know that you gotta get death certificate, right? And so it's like how many deaths occurred from especially among our elders, from Cambodia, right? That you collect that information, but is there a way we can get a hand on those data that can, because reported on the death certificate.
Um, Unfortunately, unlike surveys or birth data where people have the ability to identify it, sometimes at very fine, very granular levels, like think about like a census form where you can be very, very granular regarding ancestry. In death data, we really don't have that possibility again because of the way that the data is collected, often being reported and aggregated into these just 5 standard office and management and budget categories, or maybe it's 6 categories. I'm I'm wondering if like there might be a few of the major ethnic groups that might be pulled out in our data that might be identifiable. But again, I'm kind of skeptical that it would be there in the death data as opposed to, for example, birth data. There'd be much more likely. If
Mm.
this is really of interest, you can follow up, contact me afterward, and I can look in the data and see what actually is there. My contact information is on the like 1 or 2 slides from now.
Oh, okay. Yes, I do. I'm very interested because, I mean, coming from a healthcare background and serving the community, and to see that, how resources are being distributed, and it's all based on data. And when there's no data, and or we're not even on the chart, then how can we, right? How can we advocate for resources for our community if we don't have the data to show? So that's where I'm trying to try to try to get my hand on um the various to show the system that how much our community has been adversely impacted. And yeah, so thank you.
Yeah, thank you, Tita. And I think what you're speaking to is the power of data and how important it is for us to, I think we analyze a lot of data and we put it out there, and sometimes we're limited by how it's collected, but where there could be some opportunities to take a deeper dive. So, yeah, we'll connect and we'll see what might be possible or available in what we have available to us here at King County. But I think what you're speaking to is the importance of data that reflects community and how we identify ourselves too. So I think thank you for being a consistent advocate for data disaggregation. I always appreciate you expressing the importance of that in spaces. So thank you, and we'll um, we'll have information too in our slide deck for everybody else, as well as how to get a hold of us through contacting either Communities Count or also to our data request as well. Or Danny and Ailey have also kindly share their contact information directly too. But I'm gonna move us along and have Ailey talk a little bit about City Lead, which she introduced previously. I'm gonna cut back my own portion of the presentation because you have all had such great questions and discussion. But I will share the slides out, and you all feel free to use those links and resources. But I want to give Ailey and Danny the floor right now.
Thank you so much, and thanks for all your questions. So, just in terms of a few things that are on the horizon for us at Public Health King County next is, like I mentioned, we at the health department were chosen to be part of the city's lead project, and what that is basically a national network that is funded by the Robert Wood Johnson Foundation and convened by several partners, all of whose names I cannot recollect, but there's the Boston Health Department, Virginia Commons University, and a couple of others, and of course, Big Cities Health Coalition. But it is a learning cohort, and it brings together multiple big cities and jurisdictions across the United States. And the goal is to leverage life expectancy data and data analysis to drive equitable policy and systems change. So this is the inaugural cohort. It's a 2-year cohort that we are going to be participating in and really focused on data to action. And we're super excited to have been selected. We are one of 16 other jurisdictions. And each city or county that was chosen has specific goals. For us, our goals were, first of all, to raise awareness of our data, but also to collectively brainstorm on what should we do about these problems, that Danny shared. There is progress, but actually we're going in a very bad direction. If you think about disparities, they're just increasing and increasing and increasing, even though life expectancy is increasing and death rates are decreasing. So how can we collectively have a strategy and maybe take it to a state level or national or regional platform? So those are some of our goals. We are happy to come back and report on how that project goes. The other thing, I'll just jump to my last bullet point on here, which is that there is an urgent need to sustain the progress and close the gaps. It is a very challenging time. As we all know, we have all this progress. Opioid deaths have declined. Deaths overall have declined. Actually, gun violence, firearm deaths have declined. Crime and violence. So a lot of indicators across the health spectrum are moving in the right direction. But we also seem to be on the precipice of where we risk actually losing a lot of this progress. As many of you would know, HR 1, which is the bill that drastically cuts Medicaid, is going to result pretty soon in millions of people across the nation being disenrolled from health insurance. So, what does this mean for preventative screenings and like heart disease medication? Danny shared about cancer and heart disease, which are the leading cause of death. So, these are really important questions. What is going to happen in the next 5 years? Also, a lot of federal developments seek to cut vital social safety nets and also just tons of fear among our most impacted communities. So we really have to, as public health people and data analysts, take a step back and think about how do we start to measure and anticipate the impacts of this. So that's kind of work where we really need to do and we want to do and we're excited to do. So anyway, that's just kind of in the light of all this, we are trying to raise awareness of these findings and also work at hyper local levels to be able to leverage this data. And then we did actually have 3 social media videos on this on our death report, and I can put it in the chat. But if you're interested in knowing, that's kind of how we're trying to disseminate this to wider audiences other than primarily academic. So take a look at our videos. I just put it in the chat. Thank you. I don't know, Danny, if you have any closing thoughts or wanted to add anything else.
No, Ailey, I think you did a really great job of tying things up and framing the things that we're thinking about in terms of moving forward to make use of this. Thank you.
Yes, and thank you both so much for, in addition to making these social media videos, you're also making the rounds and coming here to speak more about this. We'll also have the recording available as well. And if you would like more information, we'll have the links in the slides, but you can see on Communities Count, we have some of these data with narrative that's being updated and will be available soon. If you want to learn more about the death data itself, we have a resource called our Death Data Biography that will tell you a bit more about the who, what, where, and when, and why of a particular data source. And there are links to the reports and other dashboards that cover some of these topics in depth as well. Here is Ailey and Danny's contact information. We'll also mail it out through the slides, but thank you again, and so many applause for all of your time and work that has gone into tracking and really putting this very important information out there for King County. We are incredibly lucky to have these type of data that we can use to inform how we're going to move forward and act, and then also to help us mitigate some of the impacts that we see might be coming along. So thank you both. I'm going to switch over really quickly. I know I mentioned that we have a lot of other data resources available, but one thing that I wanted to highlight for you all that we talked about was our King County data requests service. And so just some quick information about that. King County is unique in that we have a service where you can actually request data. Let's say that you're looking to find or identify, or you want to find data about a particular topic or a community. You can reach out to us via the data request service, and we can see what we might be able to put you in the direction of. Sometimes we're able to do custom analyses occasionally when we have information available that meets folks' needs and capacity. So if you're looking for data, the data request is a great place to start, as well as our Communities Count website, communitiescount.org. We have data, indicators, narratives, blogs that do some deep dives on specific topics. And so that's another place that you can go if you're looking for data about health and health equity. Think of Communities Count. And just to plug, we will be doing more of these road shows throughout the year. We'll be doing them about quarterly on different topics, featuring some of other speakers that folks might be interested in. We also do kind of these data resource tours or presentations. We can tailor it a bit to topics that an organization might be interested in, but we do these at request and depending on capacity. So if you're interested, you can get in touch with us at communitiescount.org. For example, we did a recent one looking at data specifically about Kent for Kent Human Services. That was really great. So if you are interested in possibly hosting us for a data roadshow, reach out. And I just wanted to plug really quickly, we have kind of a user group community advisory group called our Community Data Alliance for local data users to get connected with. Our next meeting is 6:30 next Tuesday, or in a couple Tuesdays. So if you're interested in learning more, feel free to reach out via the inbox and we can send you an invitation. But thank you all for being here, and a big thanks again to Danny and Ailey, our guest speakers, and from the Communities Count team. Appreciate you all, and stay cool out there. Thank you.
Thank you.
Have a good afternoon.